Good evening, you guys. This is the graduate student current issues presentation portion of our project. I will be discussing genetics and type 2 diabetes and the individualization of nutrition recommendations for type 2 diabetes with genetic mutations or dysfunctions. So some key points that I will be going over is genetic-based precursors to type 2 diabetes, genetics and their effects on pancreatic beta cells, nutritional aspects or diet styles that aid prevention of type 2 diabetes or mitigation of type 2 diabetes, food suggestions that help aid in glucose processes to help prevent and further help reverse or put type 2 diabetes into remission. First off, what is type 2 diabetes? It is a metabolic disorder that is indicated by the loss or dysfunction of pancreatic beta cells. So, this is resulted from metabolic stress as demand for insulin becomes too high. You can see in the image to your left that as glucose enters the stomach, the stomach then converts the food to glucose. However, the volume of it is too high, so as the glucose starts to enter the bloodstream, the pancreas starts to produce insulin, but the amount that is needed, it has become resistant to it, so it is not able to effectively allow glucose to enter the body. So the blood glucose levels then increase. What are pancreatic beta cells? These cells are regulated by transcription factor 7 like 2, so TCF7L2. These cells are regulated by the protein coding gene TCF7L2. This also affects the insulin secretion as pancreatic beta cells are used to help insulin secretion in the pancreas. So when they are deformed or destroyed as demand from insulin is too high and has become resistant to glucose, it it cannot be regenerated. You will have to use stem cells or other various sources. So how do we protect these cells? First off, for individualization of nutrition recommendations, there is a phytochemical called resveratrol, and it can provide a protective-like effect when consumed. It helps prevent inflammatory damage by cytokines to the beta cells, and for type 2 diabetics, this would be very beneficial to help start maybe the reversal of some damage or inflammatory damage that's been complete to the cells. For type 2 diabetes, foods that would be beneficial are grapes, plums, and nuts to help these beta cells and help put the type 2 diabetes into remission, or reduce the risk of developing it. Any aid that the pancreatic beta cells could get is probably very useful. So what are the genetic precursors of type 2 diabetes? As mentioned before, the transcription factor 7 like 2 is a protein coding gene, and when silenced or deformed, it actually inhibits the pancreatic beta cells from their ability to secrete insulin. So as the cells become deformed or destroyed from maybe the gene being mutated or morphed in some sort of way, it cannot break down the blood in the or it cannot break down the glucose in the blood system, and the protein coding gene cannot regulate the insulin secretion correctly, so it is not able to function to its acceptable level because cells have been deformed and it's trying to send a message that cannot be received. So the next would be solute carrier family 2 member 2. This codes for GLUT1 and GLUT2, glucose transporters and sensors. Above, you can actually see the solute carrier family 2 member 2 in a 3D model, as much the previous slide. GLUT2 is a glucose transporter that regulates the pancreatic beta cells and release of the insulin. RS5400 is a polymorphism actually of the GLUT2, which leads to the decrease in sugar sensitivity. So as the decreased sensitivity for it, most usually have a liking to sweetness, as they're not sensitive to it, so they want more and more and more of it. So this leads to the overconsumption of sweets. So it's pretty indicative of developing type 2 diabetes. Recommendations would be to limit excessive intake of the carbohydrates or excessive intake of sweets, and reduce energy consumption to allow the glucose sensor to return to an appropriate level of function after said example type 2 diabetic it has consumed too much sugar. Another part of it is the GLUT2 also transports fructose and galactose. It is a part of the membrane receptor of GLUT2. So as it becomes morphed from the RS5400, it cannot transduce a signal to the beta cell to actually secrete insulin. So helping to mitigate these from very balanced levels of sugar would help prevent this. So what are some individualization nutrition recommendations for type 2 diabetics? One would be reduced energy consumption. So as the energy consumption is reduced, there's a decrease on the stress load placed on the metabolic system. Most type 2 diabetics have placed too much stress on the metabolic system from the glucose that they have been consuming. So this would help to bring insulin sensitivity back, and the body would able to metabolize the glucose within the blood. If pancreatic cells were not destroyed, or stem cells were implemented for this reason to help balance the blood glucose, reduced energy consumption could help return these beta cells back to acceptable functioning insulin secretion. So the next is limiting carbohydrates, a ketogenic diet style. So widely thought to be the most beneficial for type 2 diabetic. However, alone, it cannot be the only sole factor in solving type 2 diabetes, or reversing it, or putting it into remission. While a ketogenic diet has been proven to help stabilize blood glucose levels and insensitivity, it has shown little ability to reduce the A1C, so the measurement of sugar in the blood. Lowering carbohydrate intake does help. However, a moderate carbohydrate would be better suited for those with diabetes, as well as type 2 diabetics, as moving into a ketogenic diet should proceed with caution, as energy consumption from a ketogenic diet typically depends on fat. So about 70% of ketogenic diets come from fat, which could lead to cardiovascular disease for those that are at risk. So for recommendations for individuals with type 2 diabetes, ketogenic diets would be better to be aided in other forms if they're maybe focusing on protein as the main source of energy. Intermittent fasting is shown to be the most effective in reversing type 2 diabetes. It is better effective when combined with ketogenic diet. As I said in the last slide, ketogenic diets do better aiding in other diet styles. The Licktesh study in 2016, a 54-year-old woman had started a ketogenic diet and intermittent fasting, and within 4 weeks she was able to reduce her A1C from 9.3% to 6.4%. When she started the study, she was on metformin. She was a diabetic for 15 years, and after 4 weeks she was able to be completely off metformin and have her A1C reduced to 6.4%. So they would keep an eye on it, but it is not as dire need to get your A1C down as others. Another study, Firmly study in 2016, this was an 11-month study of 3 patients, all with at least 10 years of being type 2 diabetic, or their diagnosis of, and they were all on metformin, and they had also completed an intermittent fasting diet. They were allowed to eat dinner, and this was also a ketogenic based diet. And after one patient had completed it in 7 months, the other 2 were in 11 months. At the end of the entire study, all patients were off metformin and their diabetes were in remission. So the individualized diet recommendations, the best recommendation would be for type 2 diabetics with these certain genetic dysfunctions or polymorphisms would be best suited to take a ketogenic diet with intermittent fasting. And this has been my graduate student current issues presentation portion. Thank you.